I'm Margaret, and I was in a group with Johanna and Emma. We decided to do our presentation on Lyme disease. So what is Lyme disease? Lyme disease is a tick-borne illness that is an acute, recurrent, inflammatory disease. It is also characterized by periods of exacerbation, which is just another word for making the problem worse, and remission, which is just another word for improvement. It typically occurs in the summer or early fall, and this is just because ticks are more present and outside in this time, you're more likely to get bitten during the summer or early fall than you would be in the winter. Lyme disease develops in 3 stages if it is untreated. The first stage is known as the early localized Lyme disease stage, and in this stage you're not going to see very many symptoms, but there will usually be the presence of a bullseye rash around the tick bite. It's usually characterized by either a white ring or a red ring with either like a purplish hue where the tick has broken the skin. The second stage is known as the early disseminating Lyme disease stage, and in this stage you're going to start to see some symptoms, and a lot of them are flu-like. You'll start feeling fatigue, fever, chills, and also weakness. The last stage, the slide was a little bit on this one, but it's called the late disseminated Lyme disease stage. And this is when symptoms start to get pretty serious. You can also see some development of chronic arthritis along with an increase in either neurological or cardiac symptoms. So let's go into these symptoms a little bit more in depth. But you're going to see the early symptoms around either stages 1 or 2, and then the later symptoms. There are so many different symptoms that you can see, but these usually are in the last stage. So it's important to note that the onset of symptoms really varies between you and how your body is reacting to being bitten, because it takes about 3 to 30 days for this disease to develop. The tick must be attached for about 36 hours for it to transfer that disease to your body. So the early symptoms usually include chills, fever, fatigue. You can have a headache, a stiff neck, rash development, and also flu-like symptoms. The later symptoms, you can see that bullseye rash getting worse. It'll get bigger, probably more purplish looking. You can also see a development of meningitis, Bell's palsy, weakness or numbness in your limbs, nausea and vomiting, severe fatigue, hepatitis, eye inflammation, heart problems, and joint pain and arthritis. So now that we've kind of looked at these symptoms, what is the overall cause of Lyme disease? It is caused by an organism called a spirochete that is spread through the saliva of a tick while it is ingesting blood from its host. Not all ticks carry this organism, and not all bites from an infected tick will give you Lyme disease, but it's really important to, if you have been bitten by a tick, check to make sure that area isn't getting any redness, because this is a very common disease and it can occur. There also could be a genetic immune response that would make you more protected or increase your risk of getting Lyme disease. It really just depends on you and your genetics. So next, some assessments and diagnoses that your doctor is going to make. First, he or she will take your history, and they will make sure that you have been exposed to a tick bite in the past 3 to 30 days. They will ask you questions such as, were you in an area with lots of ticks? Have you felt any discomfort in your muscles or your joints? Have you had a stiff neck, a headache, or fatigue? These are all early symptoms, and the doctors want to catch this as early as they can because they want to make sure that you're not experiencing pain or any severe symptoms that can develop in that 3rd stage when things get worse. Second, they're going to make a physical exam. Doctors are going to examine your body for an expanding rash at the site of the tick bite and see if they have a low-grade fever. They're also going to inspect your face for any signs of paralysis, get your temperature, listen to your heart, and possibly do a neurological exam or a range of motion test. Lastly, but not least importantly, would be the psychosocial exam. You as our patient may be feeling anxious about the unknown, fear about your disease and how it will progress. You might also feel afraid or frustrated about your symptoms. And your doctors want to make sure that you, the patient, are well supported by your friends and family. We as your nurses are here for you and we want to support you as well. And so as your nurses, we are going to be helping you cope with your anxiety, control your symptoms, and understand your medications as best you can. We also want to educate you and about the progression of your disease to support you along the way. So this leads to some treatment. So doctors usually prescribe antibiotics for this on a 14 to 21 day course. This is probably the most common form of treatment because it's the most effective and other treatments haven't shown as good results as antibiotics have. There are two types. First is oral, and this is just the standard treatment for early stage Lyme disease, and it's given in pill form. It's probably the most common. The second form of antibiotics is intravenous, and this is used if your disease involves that third stage or if you're seeing some central nervous system damage. The doctor will probably recommend treatment with this intravenous antibiotic, which is given through an IV, because it can get in your body pretty fast and help fight that disease. It's also highly effective when compared to the oral antibiotic. Some other common forms of medication would be penicillin. This is just used to stop the growth or kill specific bacteria, and also amoxicillin is used to target and reduce any infection that you might have. Another form of treatment would be non-steroidal anti-inflammatory drug, and this is really just a painkiller. It's used to decrease inflammation and also reduce fever. A common example of this would be the drug ibuprofen. So lastly, some prognosis and follow-up. As your nurse, I just want to be informing you as a patient that your recovery is really going to vary. It depends on the severity of your disease, because a lot of patients recovering from Lyme disease usually get better over time, but it can take many months for you to feel better. If you have been treated for Lyme disease and you're feeling still unwell, please don't feel afraid to reach out to your healthcare provider and discuss additional options for managing your symptoms. Next, I just want to point out some important statistics. Each year, approximately 30,000 cases of Lyme disease are reported in the U.S. This is a very common, but also a very deadly disease, especially if it goes untreated or unnoticed for a long period of time. So it's really important to take preventative measures and prevent this as best you can. So first of all, you want to cover up. If you're going hiking or camping and you know that you're going to be in an area that is infested with ticks, it's always important to wear protective clothing so that ticks can't get on you and climb up your body and bite you. Also use bug spray, wear protecting clothing, I already said that, and then make sure to just check yourself when you're done being outside, just to make sure that you don't have any ticks on you or attached. And then also importantly, don't assume that you are immune. If you've already had Lyme disease, all it takes is another bite from a tick who is carrying that bacteria, and you can develop it all over again. Lastly, but very importantly, is remove a tick as soon as possible if you do find one on yourself, because a lot of people are sometimes afraid to remove it. They don't know if a lot of times there will be people who say, oh, the head can get lodged in you, but it's really important to get it off your body as soon as you can so that that transfer of bacteria can't occur. The best and safest way to do this is by using tweezers, because if you burn a tick off or smother it with a chemical, it makes the tick more likely to infect you with the organism causing Lyme disease. These are the references I use. If you have any questions, I'll do my best to answer them. Otherwise, you can click these links and do some research for yourself.